On today's show, uterine abrasions. We'll see you in just a few seconds. Good afternoon, everybody. I'm Ross Krzyzewski, the host of the Dr. Patrick Flynn Show. It's going to be a crazy episode today. What's happening right now in the studio during that little intro is quite crazy. So hold on, buckle your seatbelts, because it's going to be a crazy ride. We have two guests joining us today in the studio as well, two amazing doctors from two amazing affiliate offices of ours. But today, we're going to be starting off with talking about, I said abrasion. I read it wrong, but that's how it was submitted. Someone submitted a question about a procedure that she had, and it's ablation.
Yes.
Now, me not being a doctor, knowing that I did stay at a Holiday Inn Express last night, so I kind of feel like one sitting up here next to this amazing individual, by the way, who is Dr. Patrick Flynn, the hormone whisperer man who can speak to your hormones better than anybody else on this world, this planet, this big ball of dirt. Talk to me, boss.
Big ball of dirt?
A big ball of dirt. That's all I've said it a couple times.
New for me every single week.
Well, if you go out there and you start digging and you don't hit dirt,
you're in trouble.
You're in trouble.
you're going the wrong way.
There's some places where you might hit rock, sand, or something else. But, okay, ablation. What is the difference?
Abrasion is actually, they spelled it wrong.
Okay.
So that's what it really was. They spelled it wrong. It's ablation.
Oh my gosh.
A-B-L. Once again, but it sounds very similar that way. So, but I see the question there. And so why don't you read the question? And once again, I always want to say this, because this is a cool question, because the answer is in the question. And in medical, and I would tell you right now, get every endocrinologist, get every OB, get every female doctor in the world to watch this, because I'm going to show you how we can figure out this woman on this show without even testing, okay? Yeah. But it's kind of cool. But then how to take care of this person, she needs to get tested so we know what to do with her. But there's some cool things, because there's so much different with endometrial ablations that way. So I'm going to show you some cool stuff just from this question.
Beautiful. Here we go. And this is what it says. I'm having an ablation done on the 16th due to polyps and the thickening of my uterine lining. Can I get some reviews on this issue? Thank you.
Yes. Okay. So once again, ablations are done when the uterine lining gets extremely thick. Okay. Now it can actually get thick for two reasons. Number one, remember, if you look at what the endometrial lining does, it's a preparation process for an egg to possibly implant on from roughly day 16 to 21. Okay. So the thickness has to be perfect. Like, for example, as Nicole and I were in our room, we're going over some ultrasound results, probably I'd say maybe about a Friday, like 3 or 4 Fridays ago. And we said, what does Dr. Flynn do on a Friday night? We're looking at uterine linings. We did that live on a Friday. Go back and check it out. Right. And we showed that this woman had an extremely, extremely thin lining. And even though she presents as a healthy young lady, she can't get pregnant. Do you understand? Because that uterine lining is too thin. Now, what happens is this, but that uterine lining is developed by all of the estrogen levels. All of them. Estrogen levels.
There you
go.
Okay.
You know what I'm saying? So therefore, our question to the young lady was right away, said, have you had those tested? And her answer was what? No.
Not all of them.
None of them.
Oh, really?
Oh, yeah, this woman has, the one thing that's really, really sad, I always say that most medical testing is incomplete. Heck, sometimes I want them to do something.
Okay.
Just do something, not just go into form. She already had Clomid. She already had some of these other procedures. She already had an IUI. And I'm like going, just do something.
What's an IUI?
It's a step before in vitro fertilization and stuff like that. Basically, they're squirting some sperm up there.
Got to educate this guy along the way too. Yes. IUI means.
Okay, yes, I guess it's second nature to me. I forgot to explain to you.
Yes, it is.
And stuff like that. And since you could never physically have an IUI, you probably didn't read about it too much,
exactly.
Okay? Dealing with it my whole career. But here's what happens. So the idea is, but here's the thought process. If it's thin, once again, in our prediction, which came out, we got our lab test back, that several of her estrogens were extremely low. So the development of that lining was actually too thin because her estrogens, there was actually 4 of them that were too low.
Gotcha.
Now, because of all 10 of them, the 4 that we knew that were abnormally low, our doctors, Nicole and everything, knows how to complete that care to get those back to normal. So now that uterine lining will become normal.
Gotcha.
Okay, do you follow me on that? But here's what happens, ladies. If that estrogens were low, those 4, it affects more than uterine lining.
What else?
It affects your mood. It affects your bone density. So if that young lady continued to perpetuate that, she'd focus on infertility because she'd be going through that emotional devastating thing not to be able to have a child. But here's the biggest thing. What do you think she would end up by the time she was 50 or 60 years old? Osteoporosis. Because certain estrogens, vitamin D, and calcium levels have to work all together. So this lady could eat all the calcium she wants.
When your estrogens are low like that, is it depleting those levels?
Remember, most commonality for women for osteoporosis is certain estrogens become deficient.
Deficient, okay.
It's why it happens a lot in menopausal women, because they drop too low by the time they hit menopause, okay? But here's the point. So therefore now, on the flip side, an ablation is done when the endometrial lining is way too thick. So once again, forget this. They don't even test. Let's go with the procedure, because I can tell she's been with doctors that are clueless about her uterus. Don't disagree with me? Do you understand what an ablation is? It's a surgical procedure. And here's what happens. This is how it's defined, okay? It's a surgical procedure that destroys. Now, guys, I'm not joking. This is how it's defined in the medical literature. I pulled up just quickly because everybody knows what this is. This is Mayo Clinic, and they define it perfectly. I agree with Mayo Clinic 100% on this. So you can just go on Google search. I tell people, the internet was the greatest invention of healthcare ever, because you don't have to listen to a doctor anymore. You don't have to listen to us.
You can inform yourself.
Well, if you are guided with the proper thinking.
Sure.
So here's you go. It's a procedure that surgically destroys, the direct quote.
It doesn't sound like a good word to be in the same sentence with uterus.
Yeah, but see what happens is this. Ablations are so common, we don't fear anything anymore. See, I would say don't confuse common with normal.
Yes.
But actually, when things become very common, we don't fear or question the procedure anymore.
Sure.
Do you see what I'm saying? Mm-hmm. It's kind of funny because it's repeated over, and you can say the wrong thing over and over and over again, and people
it becomes truth.
Truth?
Yes.
For example, what is very important in the history of our whole country this week? Come on, you know I love my politics. Columbus Day.
That was
the
yesterday.
biggest lie in history. Columbus didn't discover America. He never even made it here. But if you say stupid stuff all the time, people believe it. They do. They really do. And it's the same thing. So here's what happens in medical procedures. When they're so commonly done, they don't question and they don't fear them anymore. Do you see what I'm saying? Because it's common procedure.
Sure.
Common doesn't mean it gets you back to normal.
That's
You've
right.
already said common doesn't mean normal in the first place. But so here we go. So now, Mary, the goal. So here's your end result. The goal of the menstrual ablation, endometrial ablation, is to reduce menstrual flow. In some women, menstrual flow may stop completely. Yes, because they basically destroy your lining and you can't even menstruate anymore. So that whole lining doesn't even slough off because they destroy the capability to regenerate it that way.
So if you destroy it, does that then end the possibility for fertility?
Well, if they cause permanent damage, yes.
Because see, that's what I meant. You say destroy, that to me, I'm thinking permanent, unless you rebuild. But can that be rebuilt?
I've seen it clinically. Remember, I can only give you my clinical experience and all the doctors across the country. I've had women that have had multiple ablations and actually got pregnant and have 3 or 4 kids. And I've had women, for example, that their uterine lining, even after ultrasound, was so devastated by the ablation, heck, I just didn't want them to get cancer. Do you see what I'm saying? So if you go back to here, so let's go back to that question because I want to show you some neat thing where I'm going to be able to predict what's going on with this woman.
Okay. So
I'm having an ablation done on the 16th due to polyps. There's your key. Polycystic ovarian syndrome, polyps, are developed by high estrogen levels, mainly 4-hydroxyestrone. So I'm going to tell you right now, as a clinician, I know that I'm going to go into that lab going, I can probably guarantee you that hormone is high. So this woman probably is suffering from a high 4-hydroxyestrone. Do you see what I'm saying? And so that's why people say, and I do this with my docs all the time, I'll rattle stuff off and they're like, Doc, how'd you know that? Clinical experience. I've seen it so much, and literally, I actually want to count, but I know I'm way over this. Probably way over 50 to 75,000 different labs I've looked at in the course of 20 years, wow. Okay? And so it's just a repetitive aspect, and here's what happens. Over all those labs and all those ablations, medical procedures have not changed in 20 years. It's still their way of thinking and their own way of doing it.
Yeah.
Do you understand? And that's why they can never predict an outcome. That's why they say the goal, but then all these things can be a negative side effect because they don't know what's going to happen. So, now, on the flip side, what can also happen, I can pretty much guarantee with this young lady, that she has low progesterone. Because progesterone, even if estrogens get high, can raise to counteract that growth process. But remember, ladies, number one thing that depletes progesterone in a woman is what?
Stress.
Stress. Mental stress. Mental stress. Now, there's also physical stressors. There's also chemical stressors. We talk about this. But women by far dominate in that way. Do you understand? And that's why in the Hormone Connection Seminar, I teach women and guys all the stressors. We have to know each one of them. And then see, that's why clinically, this young lady, I hate to say this, cancel your appointment on the 16th. See, she's not a patient, so I can legally say that, but cancel that.
So what are if I'm reading this, being a guy, I have no clue. What are some of the side effects? What are the symptoms that she's experiencing with polyps and that thickening?
The only reason they really do an ablation is because her menstrual flow, she probably is, and once again, we're talking about female issues, okay? Sometimes these women, for example, when they menstruate, the blood flow is so intense, a pad, a tampon, or anything. I've actually had women come in personally. And this is where for example, I may not be a woman, but I sat there with you toe to toe and had women come in literally wearing diapers because the embarrassment of actually, she didn't even want to leave these women don't even want to leave the house on the day 1 through menstruation until day 3 or 4. Because it's so heavy. Because it's so heavy that even a tampon or a pad can't help. And these women, and that's why, hey, do you understand? This is not a joke. I'm going to tick a lot of women off. Do you know what actually helped women become more in the workplace in the 60s? Female feminine products.
Ooh. Because
you know why? Women actually, when they menstruated, were at home, they actually, wore very thick pads and things like that, but female hygiene came about majorly in the 60s, which allowed women to work through the course of the month. That's why this whole thing is women are at home. Well, sometimes women are home because day 1 through day 5 was bad for them, and they had no way to do it. So they say, well, can't work this way because it's my cycle. Well, that'd be tough for a business to be able to do it. So it's not a joke. That's why I love history. That's why I love politics, because politics is just history that way. And you actually understand that, for example, that wasn't that every woman wanted to be home. I guarantee there's driven men. We got driven, motivated, love to work women around us all the time that way. But if feminine hygiene couldn't have been, at least adapted and controlled.
Sure.
Do you see what I'm saying? So when you have these women that have major estrogen dominance and major progesterone deficiencies that way, that all of a sudden they have their cycle, and once again, they come and wear diapers. And they don't feel like women. They're actually embarrassed.
So is that evident then potentially of a thicker lining if it's heavier?
Yes.
So a thinner lining means what? Less blood flow?
Well, less blood flow.
Shorter.
Actually shorter, lower estrogens, higher progesterones. But here's the key thing is this. Here's the key thing to everyone. Every person that I've ever seen clinically or in my other doctor's offices, and we have 2 awesome offices here, okay? Here's what happens. It doesn't matter what office they came into. We have 2 Dr. Justins here. Yep. They could be any of our offices that way. These patients, these beautiful women, were never tested properly. And they were clueless. So when you sit there and go, Doc, you're getting to the microcosm of 4-hydroxyestrone, which most people, especially if you're new to listening to me, you're like, what the heck is 4-hydroxyestrone? Do you know what I'm saying?
That's me.
You know that when I was showing the lab. I've already measured yours, okay?
It's high.
Yeah. Okay, but you get my point, though? See, so that's the key. The key is the approach.
Sure.
The approach. But the approach is so common to have ablations that we accept it as normal. If you think destroying the uterine lining is normal, you have to live on a special kind of stupid island. Do you follow me?
Stupid is as stupid does, just like we've said before.
I'm like going,
Yep.
so this doctor that recommends an ablation, I understand. He's handcuffed with his tools and ability. It doesn't make it right. It doesn't mean you can't even change the uterus. But when the clinical realm for you is to destroy your uterine lining, you have to be, I'm sorry, but I may sound mean right now, but we talk about female abuse. you're physically abusing their body and getting paid for it.
Yes.
Mic drop. I'm out of here.
Mic drop. Bye-bye.
I'm out.
It's been great.
Okay. You get my point?
Yeah, it's been, when we've done some of these seminars, when we've traveled around, I remember when we were down by Dr. Matt Woomer. And
Yes,
there was
Dr. Matt.
This young girl that came up to you, and I forget her age, but I think she was in her early to mid-20s, and she already had a hysterectomy.
Oh, yes.
Do you remember that?
I do remember
and
that.
She heard the information
Heather.
within that seminar, and she wished that she would have heard it before.
Yes,
Because that's something you cannot reverse.
Yes. And that's one thing why, for example, this past Saturday, we had Dr. Thomas on the show, and we were just doing a quick tip, and I just wanted to interview him because here's the coolest thing I love about it. We have male practitioners, we have female practitioners, we have the most amazing staff across the country, and we have docs that, for example, that are willing to stand up and stop this abuse. You talk about abuse of women. I always said healthcare, and I'm not saying that this doctor is abusive. I'm saying, for example, we have to think about this way, that procedures that they put out there, if I ever said, listen, if you ever did this, if I ever caused permanent damage, destructive to a woman's body, I would go to prison. Do you see what I'm saying? Yet we create medical procedures that literally tell people it destroys it.
Yes.
And they get paid for it. Think about that, guys. I know I think differently. I know I perpetuate this wellness way idea all across the world now, but people say what Thomas did really well. Dr. Thomas showed that he's from Sweden, practicing in Ireland. It doesn't matter where you go. The thinking is the same everywhere. That's why everywhere we go, it doesn't matter what political affiliation you are. It doesn't matter what nationality you are. It doesn't matter what religious belief you are. It doesn't matter where you stand. They're all sick. And because this thinking perpetuates.
Yes.
And now we're going to show you some docs.
Yes.
That's an amazing thing. Who we got here, Doc?
Oh, did you just call me Doc?
Oh, who we got here? Dr. Ross.
Dr. Ross. I just got an email this morning, too.
Yeah.
It says, Dr. Skorzewski, are you still accepting applicants? And I'm
That's
like,
right.
oh, I like that.
Yes.
So with that, ladies and gentlemen, would you please welcome to the studio on this beautiful Tuesday, Dr. Justin Mosley and Dr. Justin Pierce.
So we got Dr. Justin and
It's
Dr. Justin. So we're gonna
Squared.
have them sneak in a little bit here.
Yep. Hop on in there.
Yes. Sneak on a little bit there. Okay. Actually, we'll stand a little bit here.
Yeah.
So.
All right.
So Doc. So
where are you from?
Lexington, Kentucky.
Nashville, Tennessee.
A little bit louder there, boss man.
Nashville, Tennessee.
See, you should be able like Elvis. That's right, Nashville,
Thank you.
Tennessee, baby.
Oh, well, thank you very much. That's right. I never asked them if they're Elvis fans.
Well, you need to
I
right
did
now.
Elvis blanket.
Oh, that's right.
You struggle- you
Oh,
struggle with
yeah, my
Elvis?
Elvis blanket last night because they stayed at my house and stuff like that. So Doc, well, tell us a little about yourself and like I said, and what you see out there today clinically, because you guys both practice. You both practice with your wives. You're saying so. I want to say hi to their beautiful wives, Dr. Courtney and Dr. Shannon. And
We're
stuff like
praying
that.
for you every day.
That's right. They're amazing ladies. So Doc, I want to start with you. You're close to Rasta that way, and just tell us a little about yourself and about what you've seen clinically out there too.
Sure. Yeah, we've been doing Wellness Way here for the last year and a half, 2 years or so, and we see a lot of gut issues today. Leaky gut is such a big term today.
Yep.
People don't have any idea what that really truly means and really what it causes, because then we see a lot of thyroid patients. My wife, she's become sort of an expert when it comes to thyroid, but what the heck is a thyroid problem? Where does it come from? It's not a lack of whatever drug it may be.
Yes.
Right? I believe one of the first times, Doc, we talked to each other, and he said, do you know what the number one contraindication for a thyroid medication is? No idea, right? I have no idea. Go up, you look it on the internet, and it's adrenal insufficiency.
Yes.
Well, what does that happen? Where does that come from? It comes from maybe some gut, some digestion issues, some food allergies, some infections. Getting down there and just figuring out exactly what's going on and what the cause of it is. We have just been able to see amazing results in our office. So
Yes.
good.
Yeah. And then clinically, you've been able to apply this, and you've seen a greater expansion to what you're doing already.
Oh yeah.
And so that's the greatest thing. So Doc, tell us a little about yourself. What you see.
Yeah, so Dr. Justin Mosley, Nashville, Tennessee. And yeah, I mean, he covered it really well. I think the biggest thing is, people are looking for answers. They're looking for something different.
Yes.
But just the lack of testing.
Yes.
Like you were saying, either they've had no testing or they've had a very limited range of testing.
Yep.
So just being able to test and actually show them, hey, this is what's going on and this is what we can do to help you. Then it's just mind-blowing for them because it's the answer they've been looking for.
Yes. And there's one thing that I want to point out, and I know how they're going to answer, but I still want to ask this. When all these sick people come and see you, are you their first choice? Are you the first doctor that they saw?
I wish. We should be.
Yeah.
Should be.
Should be, yeah.
That's the
No.
point. See, clinically, they've actually seen, and I know it sounds dramatic, but they've seen the abuse women and other people have been through that way. I mean, literally, people are getting their organs ripped out all the time. I mean, we went to your which one seminar? No, it was Matt Wormer's. You know what I'm saying? But that's a common story. Once again, a common story. But you know something? It's accepted as a normal procedure. Like, oh, I had my uterus all ripped out, and I'm 20-some years old. I mean,
Can you still help a girl like that, though? If her uterus has been taken out, she's 20, in her mid-20s, can you still help her?
well, let's let the doctors answer that
Yes.
because I know how they're going to answer.
Come on.
We're the only people that can help.
Thank you.
So,
No, wait, doc, but that's arrogant because you know
Yes.
something? You're just a chiropractor.
yeah.
No, it's not a joke. But I'm like, but see what happens is, and I bring that up repeatedly that way because at least our degrees got us to think differently.
right.
And then we came with an amazing approach, for example, because once again, as you know, my wife's story led me to figure this out. But really the thinking allowed me to think it, come with that conclusions that way. So once again, so if a uterus is taken out, if you know, now remember, let's even go back 10 years ago. If a uterus was taken out, HRT was a very common therapy after that. Most endocrinologists, most OBs don't even prescribe that now today because why? What's the major effect? Because I won't say side effect because that's what happens regularly.
Sure.
What's the major effect? You guys already know it. Cancer.
Oh, cancer. Yeah.
Cancer.
I'm still trying to figure out what HRT is.
Yes.
It's a type of car.
I'm one of those guys. I might be
Hormone
it's a
replacement.
type of
He's
car.
only
Type of
been
car.
around me for
Well, I
all
know,
my
but
life.
I'm also thinking of the people that are watching.
Okay,
you
okay,
know,
so he's being devil's advocate. Okay,
Yes.
so hormone replacement therapy is a normal aspect, and so what like Dr. Justin just said, if all of a sudden somebody comes in no uterus, they're now what happens is they either gave them HRT, or are saying we don't want to give you anything now, and they're leaving these women so deficient. They're leaving these women so devastated that they're going to end up with major health problems that way. So, and remember, and you're from Nashville, and how sick are people in Nashville?
Very sick.
Do you say you're from Lexington, Kentucky, and how sick are they there?
Even sicker.
Yeah.
So,
Yes. Yes. And the one thing is this: if you think about it this way, universally, wherever we go, our approach applies to who?
Everyone.
Everybody.
Yeah.
It's a great. It's one of the greatest fulfillments I can honestly say. You're saying it's like no matter where I go speak, no matter what we talk to, it's basically we can go in a small town or a big town, and once again we see women, we see guys. Remember, I know we focus on women a lot because once again, when their systems go off, they go through more emotional and physical things than guys do. You know, guys once again, a lot of times by the time they realize there's something that comes up, they're dead. You're saying it's not a joke. You know what I'm saying?
Wait so long.
The way too well. What happens even if they don't present any symptoms, their physiology is so covered up by testosterone that their heart could be degenerating, and all of a sudden they drop dead and they're like never knew they were sick. Well, because once again, we have that healthcare system that leads us into that kind of thinking. So
You know what I love about this right here? We've got 2 different offices, but if you take any one of the Wellness Way doctors and put them in any of the offices around the United States, you're going to get the same results.
oh yeah,
You might have a little difference in an adjustment,
yes.
but getting the clinical results and the we don't guess, we test, it's applied across the board.
Well, like I said, because here's what happens: that woman that actually sent that question, I'm so proud and excited that they could actually walk into any of our clinics
Yes.
and actually have great answers. Do you know what I'm
Absolutely.
saying? It's just that I'm a jerk enough to say that what they're doing is wrong. Actually, it's kind of joke. These are nice guys. You know what I'm saying? I'm the jerk of the family here and stuff. So, but I'm willing to be a jerk when actually having and you guys experience this. And it's really funny because I have to tell some cool stories about these two that literally they will call me and they will be frustrated, mad because they had a person come in so devastatingly sick that it just aches their heart.
Sure.
That's the heart that they have, that they're sitting across from a person saying, you would not believe what this woman goes through. And what happens, I'm like, oh yeah, I can believe it. You're now starting to see, and women and guys are sharing the most deepest, intimate things with these guys. Because why? Because they know that they can help. They know that they have answers for them. So,
I think we're going to see, as you were saying before, you're always the last resort. But I think what we're saying with all these wellness way babies that we're saying, we're going to be raising a generation of children and young adults that make the wellness way doctors their first choice.
Yeah.
Based on the results that you guys are getting them.
yes.
Absolutely.
So, some closing thoughts from you two. Because we got about, 5 minutes there, Fancy Nancy?
Yeah, and what about their stories?
I love their stories. That's what I said. Let's hear a little bit about their stories.
absolutely.
well, I didn't grow up in a wellness way model. I grew up in, I would say, the complete opposite. And I would say, I grew up in what I call the 3 Ds. And it was Dunkin' Donuts, Doritos, and Dr. Pepper.
Oh, that sounds...
It is.
Look at that.
Doritos, Dunkin' Donuts, and Dr.
Then Dr.
Pepper.
Pepper.
Okay, quote him on that. That's a good one. The 3Ds.
The 3Ds. And that was my lifestyle. And we were always on the go. And it's you don't have time
Yep.
to prepare your food and to cut up a vegetable. That takes way too long to do. We got to go through drive-thrus and do all these things. And so we were sick. We were family was overweight and lots of health issues.
Yep.
And it's drugs. It's your high blood pressure is obviously a lack of lisinopril, or your overweightness. Is fatness,
There you go.
Overweightness.
New term
your
from Dr. Justin.
obesity is because of a lack of a stomach surgery.
Yep.
And so growing up that way, like I knew it was wrong, and we didn't feel good, and so we wanted to change. When I graduated from school to become a chiropractor, my dad missed my graduation, and he was 2,000 miles away. He was actually here in Wisconsin. I was in California, and he was in the hospital having what they call the life-saving surgery, and to one point, it's like, thank God for life-saving surgeries.
Yes. Yeah.
Right? That's not what we're saying at all. But at the same time, I wish somebody would have grabbed him 20 years ago and said that if you don't make these changes today, right now,
Yep.
you're gonna miss your son's graduation. Like, you're gonna devastate him because you weren't there. I remember sitting in the corner. Everyone's having a great time, and I'm on the phone, and he's talking, in that raspy voice.
Yep.
Saying, I wish I was there for you, and I wish I could hug you and tell
Ooh.
you how proud I was. And I get emotional thinking about it right now every time I tell it. But it was tough. And I made that decision then that I would do something different and not go down that hole, that rabbit hole, that trail. And so that I didn't have to have that outcome. And I didn't have a kid at that time. But, I want to make sure that I'm there. I want to make sure that I'm there for weddings and graduations and all those good things that I should be there by making the decisions today, not when I need to make those decisions.
Good.
Yep.
Yeah, and for me, I grew up the same about as far as what we eat. We didn't know any different. And my wife, though, is the complete opposite. She's like one of the healthiest people I know, eats all organic, eats all the right things, and actually keeps me healthy now. But even her doing all the right things, she still got sick.
That's
So just the stress, the lack of testing that she never even heard before.
Yep.
She actually was hearing about her friends getting results with the Wellness Way, called up Dr. Flynn and was like, hey, I don't want to be a part of this Wellness Way thing. I want to be a patient.
Yes.
And Dr. Flynn was able to tell her what tests to get and actually walked her through the process just like a regular
person,
patient. Yeah, and it completely changed her life. And because of that, now we were like, hey, there's something here.
Yep.
We got to be a part of this Wellness Way. And now we get to see the same clinical results that she got with our patients as well.
Can,
So
can
how
I
did
tell-
that work out for you real quick? I don't want anything to do with that. This is just my wife. How's
And now
it
you're sitting on
working out for you?
camera with us. We're in the same shirt.
Teaching and the
That's right.
organization?
Yeah, it's
Yeah, teach
life
it.
changing. So.
Yeah, well, I have to. Courtney's probably going to kill me right now, Dr. Courtney, but I got to tell a funny story, and so it relates to you and stuff. So it was kind of funny. So because once again, because the amount of you guys have a very successful practice, you guys, like I said, have a great life, but it can be a little stressful. Anybody can, you see? And so what happened was I remember the time that Courtney's body started to just transform and do well that way. But life catches up with you. Mm-hmm. And what happened is, but then when people start to do better, they kind of slack a little bit, but the stress is still there. Then all of a sudden, Courtney calls me up one day and says, Justin said, get back on the phone with Dr. Patrick because I can see you changing a little bit in the wrong way. and I was like, and I didn't really know him at this time that well. Yeah. Only met him like once at that time. I'm like, and I'm sitting there, but what it showed was that what happens is that mental stress can, and the things that we do, just even being busy all the time, can drain a female body dramatically. And she's a very happy person. It wasn't like she was sad, but you're go all the time. It takes a taxi on a woman's body that way. And so it was kind of a funny story. That's what the story I forgot to tell during training today. I was like, that's a good story. So, but what it showed, for example, is like I said, a woman's body, if it isn't tested properly on a regular basis, it can get out of hand really quickly, even when you're doing the right things. Even when we're doing the right things. If the environment, for example, like I said, that's why the hustle and bustle of life can drain and affect hormones at a high level. Yeah. So
that's awesome.
That's awesome. Do you understand?
I love these stories because a lot of the docs that are actually part of the organization have come in because you've helped out their wives.
Yeah, well, I've always said this, and this is one thing why we are multiplying across now the world at such a high rate is any doctor that just gets to think like we do gets great clinical results for the people they take care of.
Yes.
And yes, if the Wellness Way was based on looks and they had it, it'd do wonderful. But me, I had to base it on my clinical results because my looks wasn't getting me anywhere. You know what I'm saying? And I joke about that a lot, but I want to show you the fact that, listen, if you're a caring doc and you want to change lives like crazy, guess what? The approach that we put out there, once again, is based on we can teach people how to think this way and get the best clinical results. It's why they do this. That's why I said that's why it's an us we are culture that you created. It's not about anybody, it's about all of us. It's about all of us moving forward, hand to hand, shoulder to shoulder, changing lives like crazy, and we're getting bigger and we're not going anywhere.
That's exactly right. And with
So-
that, ladies and gentlemen, we thank you once again for joining us here in the studio, Green Bay, on this beautiful Tuesday. We'll see you next week.